20 years back, people were still getting married in the early 20s. And the peak fertility is between 20 and 30.
Have you noticed an increase in male fertility issues over the years? And what are the common concerns that you see in your practice?
40 years back, the average sperm counts across the world were 100 million. So it's 100% charged at birth. And then right from birth, it starts reducing till a point where the battery is going to become weak and then it's going to die. And motherhood is motherhood, whoever your child may be, even if it's of a different species.
Hello and welcome back to another heartfelt episode of Fertility Tales powered by Nova IVF. I'm your host Simrat, and today we're diving deep into the emotional and often challenging journey of fertility, a journey that many couples face in silence. But today, we're breaking that silence with someone who not only guides countless couples towards their dream of parenthood, but has also walked that very path herself. Our guest is Dr. Sulbha Arora, Clinical Director of Nova IVF Fertility in Andheri, Mumbai. With over 25 years of experience as a medical practitioner and over 20 years specializing in IVF and assisted reproductive techniques, Dr. Sulbha has become a beacon of hope for many. Not only is she an acclaimed expert, but she's also been named among Mumbai's top 9 IVF specialists in 2020. Her commitment to making fertility treatments accessible and holistic is truly inspiring. She has been instrumental in establishing and operating several IVF centers across Mumbai and has trained numerous gynecologists from India and abroad in the field of reproductive medicine. Dr. Sulbha, it's a pleasure to have you with us on Fertility Tales.
Thank you so much. It's a pleasure being here.
Let's start at the beginning. What made you choose medicine as a career option? And was it a guided career option, or was it a moment? How did it come about?
It wasn't a guided career option at all. I'm the first and the last doctor in my family. I come from a business family. My grandfather kind of always wanted me to be a doctor. I'm the first grandchild. He was always so proud of me academically. When I was in school, I was always more interested in science and per se in biology specifically.
Right.
So after I finished my 10th standard, the choice between, those days was limited: science, commerce, art. Science was an obvious choice. I wasn't interested in anything else. And then as I started studying my science in my junior college, I realized that biology is what intrigued me the most. Especially, what fascinated me was watching cells under the microscope. Well, at that time, I did not know I was going to be an IVF specialist someday, but somehow that's exactly where the journey brought me.
How about fertility? Was it a turning point that made you choose fertility as the eventual career option?
When I was doing my MBBS, I wasn't still at that time very decided in my first 1 year that I was going to be a gynecologist. But in the second year, when the clinics started, the clinic rounds, we actually started going and seeing the patients. The first time I stepped into a gynac ward, and that's it. I knew at that time that this was my calling. So gynecology kind of just drew me in. When I had finished my MBBS and the internship was just about to start, right then, 1998, one of our gynac professors was starting her first ever IVF center. IVF was so new at that time. And she had come and told us, even at that time, before I even did my gynecology, that if anybody is interested, come and help me. So during my lighter postings, I used to go and help her in her clinic. It was new. So my, tryst with IVF started right then, even before I became a gynecologist. When I finished my gynac residency, while I was still trying to plan out about what to do next, and I was thinking of joining a hospital and doing some more exposure with general obstetrics and gynecology. Meanwhile, very close to my house, there were 2 or 3 very prominent gynecologists with their own setups. And I thought that I would go and join one of them and see what this is like. Back then, we didn't learn much about IVF or infertility during our gynecological residency. So I walked into my mentor, Dr. Gautam Alabadia's clinic, and he said that, "Oh, you finished your MD," because he knew me from before. "We have an embryo transfer at 6 a.m. tomorrow. Come." So what I thought would just turned out, was started off with something I was curious about. This was 3rd August 2004.
Oh.
And exactly 20 years later today is 3rd August 2024. There's been no looking back.
That's amazing how it's a full circle and you're able to commemorate this today. Congratulations, doctor.
Thank you.
It's almost been 2 decades now. So,
Yes.
what do you think that the fertility landscape has changed? Is there more general awareness and has the perception towards fertility changed? What do you have to say about that?
There have been a lot of changes that have taken place for sure. Within 2 decades itself, we see, first of all, the patient demographics changing. 20 years back, people were still getting married in the early 20s. And, the peak fertility is between 20 and 30. But fast forward to today, most people are not getting married that early yet. The women of today have so many competing priorities. So we do see a lot of people who've gotten married in the late 30s, early 40s. Obviously, the fertility is going to decline. Because of that, and because of, now there being so many fertility centers, there's so much of talk in the media, the movies, there is definitely a lot more awareness today than it used to be back then.
Where do you think family has a role to play here? Do you think family has a big role to play here?
Family has a very big role to play because, going through, struggles of conceiving, going through the fertility treatments, it can be quite emotionally taxing. And the support mainly comes from the partner and from the immediate family and friends. So if somebody going through this journey has that kind of a support system, it does make it easier for them.
That's true. You've mentioned that you've been around in a lot of clinics, that you've helped establish so many IVF clinics. What made you choose to stay in Nova and continue and grow it?
One thing that I really like about working here is that Nova's ethics are so aligned with mine. It might be a corporate, people worry when they hear the word corporate, but it's an absolutely ethical chain. At no point of time do they practice anything that would be detrimental to the patients. Not emotionally, not physically, and not financially.
That's good to hear, doctor. Talking about how awareness has actually become better, people are more aware due to media, self-education, and a lot of people talking about it openly. Male fertility is often a less talked about issue, let's be very honest, but very equally important. Have you noticed an increase in male fertility issues over the years? And what are the common concerns that you see in your practice?
Well, sadly, we have seen an increase in male fertility issues as well. I think when we had started practice 20 years back, it was still considered majorly a female problem.
Yeah.
And most of the couples did suffer from, factors related more to the woman. But fast forward to today, I think it's quite equal. In, say, 40% of cases, it's the woman, 40% of cases, it's the man, and in 20% of cases, it's either combined or it's unknown. In fact, it's very interesting that, 40 years back, the average sperm counts across the world were 100 million. And 40 years later today, the average sperm counts across the world have dropped to about 35 million. So yes,
That's
there
quite a
is
drop.
definitely an increase. And even with the woman, there is a much higher incidence now of premature aging of the ovaries. A lot of this has to do with lifestyle.
Of course.
With not just the personal lifestyle that people follow, their unhealthy lifestyle choices that they make, but it's because of all the chemicals in our environment. It's in everything we eat, we drink, and we breathe. There is so much more chemical exposure today than, for example, our parents or our grandparents' generation had. And that's definitely taking a toll on our health.
That's true. Can you briefly tell me about the male fertility treatments from basics to advanced? Just briefly, I would like to touch upon this topic.
So first of all, we need to try and find out why there is a low sperm count or a low sperm quality. In some cases, there is an identifiable cause, like smoking, for example. People know that it causes cancer. Very few people know that it impacts both egg and sperm quality. It increases the sperm DNA fragmentation. For couples who are trying to conceive, now is a good time to quit. It's always a good time to quit, but especially when they want to try and increase their family, have a child. Then there are other factors as well, like, for example, too much of exposure to heat, too much of, wearing tight underwears and things like that. So if you can find an identifiable cause, we deal with it. Sometimes it is due to a condition called varicocele, which increases the blood supply going to the testes, makes them warmer and reduces the number of sperms. But In a lot of cases, there is no identifiable cause. There is nothing wrong with the lifestyle or, with any of these factors I just mentioned, but the sperm count and motility are too low. In the younger couples, they could try and take some kind of medical treatment, some antioxidants with the hope of improving the count and the quality. They don't always work. So at the end of the day, if they've not managed to conceive naturally or with simpler treatment options, the best option for them is to undergo ICSI, because a procedure like ICSI has got very high chances of success, even in the scenario of very low sperm counts.
All right. So, and speaking of fertility issues for women, they've always been in the spotlight. Have you observed any trend in the fertility rates of women declining or something like that?
Some years back, the majority of patients that we used to see had problems like PCOS.
But it's very rampant.
Very
nowadays.
rampant. It is still. But what we're seeing more and more often now, like I touched upon earlier briefly, is the advanced age. The biological clock is ticking and it doesn't wait for anyone. So I'm not sure that a lot of girls know about this, because when they come to me and I tell them, I realize that they were not aware that when you're born with all the eggs that you're ever going to have. It's like being born with a fully charged battery, and the charger is disconnected and given to you. So it's 100% charged at birth. And then right from birth, it starts reducing till a point where the battery is going to become weak and then it's going to die. So at birth, we have about 20 lakh eggs in all. By the time a girl gets her first period, this is already down to 4 lakhs. The age between 20 and 30 is the age of peak fertility, because the quantity of eggs is good, the quality of eggs is good. After 30, there is a more rapid decline. Between 35 and 40, the ovaries start wrapping up. They're the last few eggs left. Most of them are too weak or too abnormal to give rise to a pregnancy. But people aren't aware of this. And this is an aging process. It's not going to stop. But the speed of aging is different from one person to another. Now, what do we mean by that? I'll give you an unrelated example. It's like white hair. It's a part of the aging process. But you see, some people have white hair as early as their 20s, and some don't till they're 50 also. So similarly, some girls in the 20s can have ovaries that don't really have eggs anymore, or they have very low quality eggs. But people are not aware about it. They tend to think, I'm young, I can conceive. The ovarian reserve could be low even at a younger age. But similarly, people well into the 30s could still have a good ovarian reserve.
All right. It's better to have a consultation right in the time. And
yes. So it's important to have the ovarian reserve assessed. And as I mentioned before, one of the changes that we're seeing is that, in our parents' generation, if we ask women, how old were you when you had your first child? Most women would say 20, 21, 22, maybe even 25 was too late then.
Yeah.
But who's even getting married at that age now? That was the age of peak fertility. But the women of today have, as I said, so many competing priorities. Education, establishing your career, being financially independent is just as important for the woman as it is for the man. And sometimes you just haven't found the right partner yet.
This is a very important thing that you mentioned here. Couples are postponing their pregnancies because priorities have changed.
Yes.
Financial stability, career options, etc. I mean, there are so many things people are now putting into spotlight than having a family. What advice would you have for people who are postponing it, and how should they go about it? What should they consider?
Well, like I said, at least get your ovarian reserve assessed. You may be 30 and you might not yet want to start a family, which is fine. But at least if you've got your ovarian reserve assessed, you have time. And you don't immediately need to act upon it. But we do have such excellent fertility preservation options available today. For the man, advancing age does not make much of a difference to the sperms.
Yeah.
They will continue producing sperms. We've recently read of Hollywood actors fathering babies in their 80s.
Yeah.
But for the woman, the time runs out. So, when we invest so much for our future, we invest in so many different, options for our wealth assets. Why not invest in your biological future as well? It's a very safe procedure to go through when you do an egg freezing. Women may not right now at the age of 30 even think they will want it later, but we see so many women who come to us 40 plus and say, I didn't plan yet because I didn't want a child, but now I do.
And it's so difficult to maybe tell them it's late now, and it might just require a different kind of a fertility treatment. But I
It
think
might. We work with whatever choices they make after explaining to them what their options are and what chances they would have with all the options. But they do say that if we knew about this, we would have frozen our eggs earlier.
yeah.
So it's important to at least be aware about these options.
And that's very important. I
Yeah.
feel this whole fact of trying to have it all, this have it all culture also needs to perpetuate a general awareness about your body and your biological clock, like you said, which is like biology, a little unfair to women because they
It's
have to make the decision.
absolutely unfair because, the woman needs to have autonomy over her life's choices
Yeah.
without feeling the pressure. But, say, as I said, once they've crossed 40, if that is the time they wish to start the family and their own biological clock has already slowed down, then the other option becomes taking donated eggs, which is fine, but not everybody is able to accept that.
Yeah.
So if, say, at the age of 30, they freeze, some eggs of their own, then later on in life, when they want to plan the pregnancy, they use eggs they donated for themselves back then.
That's true. I mean, technology has given this boon of choice to extend the timeline maybe a little bit, but obviously it's much better to have that intervention in time and assess your fertility before you start.
It would be unfair to say that no, women should be conceiving and having their pregnancies in their 20s,
Yeah.
because that does add a lot of pressure.
That's true. That's true. Doctor, let's talk about the advancements in the fertility technology. The success rates have improved significantly. Could you share some of the latest techniques or technology that are making a difference in success rates nowadays?
Well, there have been so many changes now over the last 20 years that I've been practicing. So first and foremost, the way we perform IVF, the stimulation protocols have become so patient-friendly and so gentle now that it's not as difficult to do it now as it used to be back then. So one, the success rates are now higher because compliance is better. Women are able to go through it more easily. Second of all, there have been so much of, advances in the embryology aspect, the lab culture media. We are able to take our embryos up to the blastocyst stage, which is day 5 or day 6 before transferring them. Then there is the advent of cryopreservation. We just spoke about egg freezing. There is also embryo freezing. So even if you have one extra embryo and you can freeze that, you don't have to go through the whole process all over again. We spoke about women at older ages now starting to plan a family. Not everybody is okay with taking donated eggs, but we do know that after the age of 35, 36, there is a higher percentage of abnormal eggs as well. So we have something called PGTA now, which is the embryo itself can be checked for chromosomal abnormalities before you transfer it. And that really minimizes your risk of having a negative pregnancy test, a miscarriage, or a problem with the child.
What a breakthrough, right? What a breakthrough.
I think, in fact, PGTA is, one of the most exciting breakthroughs in the field of reproductive medicine.
That's how you're able to determine, and it saves so much mental and physical trauma and emotional
It
trauma
reduces
too.
the time to pregnancy. If supposing you have 4 embryos and under the microscope, they all 4 look really beautiful and you wish to only transfer one at a time, but say only one was chromosomally normal, you might actually go through 3 failed IVF cycles before having the 4th one, in case that was the last one that landed up getting transferred. But if you've done a PGTA, you would know that this is the one you need to transfer right away.
Right.
It reduces the time to pregnancy. It increases the chances of having a healthy baby.
Yeah, that's what matters, a healthy baby.
Yes. It's not for everyone, but yes, in judiciously selected cases where it is clinically indicated, it does have a lot of benefit.
That's true. Doctor, what have been the current research in the fertility space? How will it help the future generation?
So there is now moving ahead of here, embryo freezing PGTA that we spoke about has already been there for a while. Moving ahead from here now, we are just trying to do more research into finding out why do the ones who did not conceive, why did they fail and what more can be done for them. So we call this a recurrent implantation failure where they've had at least 2 embryo transfers and no cause for that could be found out. So one of the things is doing the chromosomal testing of the embryo, because like a seed and a soil theory, it could be either the embryo or the endometrium, the uterus, where the problem lies. So for the embryo, we are already doing a lot of this PGTA and metabolomics, but what about the endometrium? So now the focus is shifting to that. I was at the ISHRE conference last month in Europe, and there was a lot of discussion about the endometrial microbiome, about trying to find out if there is an alteration in the healthy bacteria of the uterus that is causing a failure in implantation. So that is one of the things that science is moving towards finding out. Plus, then in the lab as well, in the embryology aspect, there are newer advances. There is a lot of talk about AI, for example, for choosing the healthiest embryo.
That's the future.
That's the future, yes.
And what else?
It's only time will tell whether that is really helping or not. With everything in reproductive medicine, with scientists trying so hard to try and improve the chances, to improve the experience for the patient. Every few months, we have something new that comes up. But everything new that comes up has to be judiciously selected and taken with a pinch of salt till you have more studies to tell you whether this will really benefit or not.
Right from the first IVF baby to now it being a very normal thing to have an IVF baby. I think we have come a long way, and there is a long way to go in terms of understanding fertility and what happens and what goes wrong.
There is so much at the molecular level that is yet to be understood. Yes, you're absolutely right.
That's true. Do tell us about the importance of counseling that you and the emotional roller coaster that the couples go through, and how have you been able to address that by having this open channel of communication with your patients?
Yes, exactly. So as we discussed earlier, that it can be quite an emotionally taxing journey. In fact, when people come and tell me, but IVF is too painful, it isn't actually painful at all. It's just 10 days of injections. And nowadays we use those thin needle injections. It's one small prick which just lasts for 10 seconds, maybe less. But why it becomes painful for some people is because they are so stressed out when they're going through this journey that their pain thresholds become lower and they tend to perceive pain, even though if they weren't so stressed, they might not have felt it at all. I also tell my patients, you go for your threading and your waxing. Those are painful procedures, much more painful than the IVF. But you go there happily because you're going there looking forward to the next party or the next function that you're getting dressed for. Your mind is not stressed. That's why you don't feel the pain.
Yeah.
And therefore, the importance of counseling in fertility treatments. I often tell my team as well, the science will remain the same everywhere. What can you do for the patients that is beyond science? So that is why it is so important to be there for them. I spend so much time with each patient, and we ensure that at every point through the journey, they feel supported, they feel heard, they feel understood.
And that's important, right? Like half your battle is won when there's someone to understand and help you through that.
Absolutely.
You've been instrumental in helping so many couples achieve their dream of parenthood. Could you share some of the most impactful case studies or stories that have stayed with you? What keeps you going in this demanding field? I'm sure there's one thing that keeps you going. So,
I wish there was one, but what's beautiful about this journey is that you get to form these bonds with couples that are so meaningful, because you've been there with them through their difficult times. So, so many, you asked me this question and I suddenly have so many women and so many children standing out in my mind. I think back then in 2006, I had a couple who had come down from Canada to get their treatment done. And they'd been trying for a very long time to get pregnant. They hadn't succeeded, but they succeeded in the first attempt when we did the IVF for them. And they asked me to name the baby.
Oh.
And I think that is such a big honor, because the name is something that will stay with the family forever. It's a huge responsibility, to think of a name that they will like. And so 18 years later, they and a lot of other couples are still in touch with me. The children are now in college and I still get regular updates about how they're doing. And similarly, there have been a couple of other times. There was another lady more recently who had been turned away by a couple of other clinics saying that it's impossible, you won't conceive with your own eggs. And she wanted to at least give it one attempt. Sometimes it's so important to do that. So I always tell women who may have a very low ovarian reserve that after you've understood your options and the chances that you have, I would like you to tell me there is no right or wrong choice. The right choice is what the couple feels comfortable with. And once you make your choice, I will fully support you through it.
Absolutely.
And she wanted the right to at least try once with her eggs. There are two possible outcomes, right? You conceive, which is what you're looking for. You don't. But that's all right. It's not a bad outcome. It is still a step closer towards parenthood because it helps you achieve that closure.
Yeah.
So we went ahead. We tried with her eggs. She had only 2 eggs that we could retrieve. Both did become embryos. And she was very disheartened. She said, I have only 2 embryos. Until today, she reminds me, though I have forgotten, that, you told me then that for 1 baby, you need 1 embryo. You have twice the number you need. And she did conceive. And she was the second patient who asked me to name her son.
How sweet. How adorable.
Yeah, absolutely. There are other stories as well. There was one couple who was doing treatments with me at the previous clinic that hadn't worked. And then they came to me here after I joined Nova. And we tried a few treatments here that didn't work. And then they adopted a baby girl. And, they called me up so excitedly and said that we have kept a Mata ki chauki. The jyot will not be lit till you don't come. I was so moved. This is the couple who I could not help. And I asked them that I couldn't do anything for you. They said, you were there for us when no one was there for us. And that's what made me realize how important it is to just be there for someone. So we're not just doctors, we're the privileged few in the society who get an opportunity to be healers, to make a difference to somebody's life. And it's such a rewarding experience.
That's true. And especially, like you said, you've been through that pain and suffering and the whole process. Couples do go through it silently, facing this whole trauma and emotional roller coaster. Has your journey also reflected in terms of did people have misconceptions about long-term side effects, short-term side effects? Would you like to talk about that? How
people do have those concerns. They're not completely misguided because, sometimes they read on the internet and that can be completely misleading. So, they do come and ask me, what about the short-term side effects? What about the long-term side effects? In the short term, yes, it's a prick that you have to tolerate. You might go through a phase where you have a bit of mood swings, a bit of bloating, but these are all transient side effects. They go away. They go away pretty soon. They don't last in your body. So I, also tell them, for example, if I've spoken with them about my journey, if I have shared with them my experiences, just to be able to give them a standing example of somebody who's been through it. Like we tell them sometimes, right, that don't just talk to your doctor. Talk to somebody who's experienced it so you can hear it firsthand. I think with me, it's both. So I tell them as well that in spite of going through egg retrieval procedures 12 times and frozen embryo transfers 12 times, in the long term, it hasn't impacted my health at all. I'm nearing 50 now and I don't feel it. And I get told very often that I don't look it either. So I can assure them that it's not going to have any long-term side effects.
That's good to hear for people who make it and do not make it also in either situation. What do you think about the close-knit community and support that couples need at the time of going through fertility treatments?
So support comes from many different avenues. Like I said, the most, first and foremost is the partner. A lot of times this infertility journey can cause a lot of marital discord. So we keep trying to remind them that don't revolve your life around this. Don't forget that you have a life. There's so much more to it. Spend time with each other. Don't put your life on hold. Go out on date nights. let those lines of communication between you and your partner remain open.
Very important.
It's very important. So when you're going through something, when you have each other's support, it just makes it so much easier, which is what life is all about. And then there is family, there are friends, and there is also support from the community of people who are going through this journey. So at Nova as well, for example, we hold these Circle of Hope meetings where we call couples who have not yet started their journey or have just started going through IVF. We also invite couples who've conceived, who's delivered, to come and share their experience so that they understand that they're not alone. They're definitely not alone. It's 1 out of 6 couples. But when you're going through it in silence, you tend to feel like it's just me.
That's true.
Plus, there are professional counselors. Like we have one at Nova, as per the law, every clinic is supposed to have one. And they are trained in understanding the problems and teaching relaxation techniques. So yes, the importance of support is definitely there, and it can make a lot of difference to the journey.
That's true. Doctor, to end this conversation, what would be your advice or words of wisdom for couples who are undergoing this journey? What would you like to tell them?
Not having a child yet does not make you incomplete in any way. The feelings of inadequacy tend to creep in, which is understandable. And it happens all the more when you look at others and you feel like, oh, they have a child, they married after me, they already have a child. But remember that not everyone has everything, and you have a lot to be thankful for. So when we start focusing on the things that we do have, and we adopt that attitude of gratitude, then you get so much more to be thankful for. It just changes your mindset completely. So you just have to trust the timing, trust the process. The journey could be lengthy for some, but there is light at the end of the tunnel.
And what would you say to the couples who are on the brink of giving up?
Everyone decides for themselves where they want to draw the line.
Yeah.
I would not push them and say, keep on doing it, keep on doing it. It's a personal choice. Some people would like to try again. I tried so many times. Some people would like to think of other options. There is always donor eggs or donor sperms for those who need it. There are options like surrogacy for those who need it. There is adoption. There's being a pet parent like how I am. And motherhood is motherhood. Whoever your child may be, even if it's of a different species. There is absolutely, no difference. There is also the option of choosing to have a child-free life. Whatever of these options you may choose, I want them to remember that there is a lot of happiness to be found in life, regardless of these choices. So those who are on the brink of giving up could take a break and try again, or they could decide that this is it. We don't want to try again. Either way, I wish them happiness.
That's well said, Doctor. Very well said. Thank you for sharing your wisdom and your experiences with us today. Your words have undoubtedly provided the couples, I think, words of encouragement for so many people out there who want to understand this journey and who are probably going through it, and maybe it's not going the right way or it is going the right way. It's really heartfelt for them to understand this journey, that they are not alone, especially with consultants and fertility specialists like you. Thank you so much for being on the show with us.
Thank you so much. It's been a pleasure. And I hope that the discussion we've had today, that people listening do find it helpful.
And most important for the listeners to understand that they are not alone in their fertility journey.
They are not alone. Absolutely not. It can be difficult, but it's manageable.
Thank you so much, Doctor. For those tuning in, remember that while the road to parenthood can be tough, it is not the one you have to walk alone. With experts like Dr. Sulbha on your side, there is always hope. To our listeners, thank you for joining us. If you found today's conversation insightful, be sure to subscribe to Fertility Tales powered by Nova IVF for more inspiring stories and expert-led advice on fertility and reproductive health. Until next time, stay hopeful and stay connected. This is your host Simrat signing off.